Okay, so this is Medical Training 1. Thank you so much for joining us. I appreciate your time. I know everyone's so busy, so I'm definitely going to try to get through all this material. I do anticipate they'll probably take about an hour and a half to get through everything that we need to get through today. This beginning section is kind of some intro stuff, and it won't be displayed on the Panda screen that you're looking at. Ooh, let me display my Panda screen. That's not going to do much good if you guys can't see. All right. So the first section of the training, I'm not going to be demonstrating anything on the screen, but please follow along in your training manual. The Medical Training 1 manual should be available from the super users or anybody that's provided it to you. So my name is Katie Bjornson. I am the project manager overseeing the Panda project for Willits Technology, who is the IT component that works very closely with SQL. I'm sure you guys are pretty familiar with it. It sounds like that relationship has been in place for 10 plus years. I previously worked for SQL. I worked at Mingus, I worked at Woodward, and I work really closely with Amber Taranis, who is the SQL project manager, and also Marianne Birmingham. So she is really the meaningful use guru at SQL. So if you guys end up having questions about meaningful use or anything along those lines, she is definitely the person to reach out to. So we work really closely together. If you guys have questions about anything, you can reach out to any of us at any time. So in your training manual, I provided some information on Panda and why we're implementing this system. I'm not going to cover that in detail in training, but I just wanted to provide it for reference. So please let me know if you have any questions about any of that information. I'm going to start in the Panda MU section. So Panda MU went live at Woodward on May 1st. They've had a lot of success with the system so far, and we just recently rolled out at SQL Care of Arizona on June 1st. So our next site will be SQL Alliance on 6/15, and then Bernalillo is going live on July 1. So Panda MU really is focused on the 6 SQL programs whose medical departments will be using Panda to attest to meaningful use in 2016. So basically there's providers at all of those sites that are going to be attesting to meaningful use using Panda. With regards to meaningful use, I'm not sure how much everybody knows about it. I know everybody's heard of it. Some people know a lot about it. Some people know very little. But basically, it's an incentive program that's sponsored by CMS, and it really is encouraging providers and practices to use a certified electronic health record, and then we report certain information to CMS. So it really is that reporting piece that's the most important for meaningful use, and we're going to talk about that in a minute. There's a lot at stake here. I think SQL as an organization, there's over $1.5 million at stake. There's a lot of talk about state and Medicaid contracts. They are really pushing for that requirement for certified health technology also. So this project is really important. We're definitely not just rolling out Panda just because there's a lot at stake here, and there's a lot of reasons beyond just Panda and beyond SQL. So our real goal is to get the medical departments using Panda for 100% of their documentation. I don't know if we're at 100% yet. There's a few things that we've run into that we don't have available yet in the system, but we're constantly adding functionality and constantly improving it. So that is definitely our ultimate goal. Only the medical and admissions teams are going to go live with Panda MU. We've spent a very significant time, probably close to almost an entire year, getting certified to be a certified health record. That was a very stringent process. There was 42 criteria that Panda had to pass tests on, and we just completed that a little bit before May 1st. So the reason for that is we really wanted to focus on the meaningful use certification components for the medical team so that they can attest to meaningful use. So medical and admissions will go live with Panda MU. The other departments may utilize Panda to access current medical information, like say a case manager needed to log in to see a current medication list for a patient. With regards to those other departments, we're going to be rolling out Fat Panda. I always have to laugh when I start talking about this because Amber Taranis actually named it Fat Panda. We were calling it Total Panda, Full Panda, a bunch of different things, and finally we just decided to go with Fat Panda. Basically, Fat Panda is the full system. It is going to be the case management, the clinical, the QA, the direct care staff components. So that is definitely our goal, is to get SQL as an organization and all the sites working to use one system successfully in one location. So we know it's not necessarily ideal that we're rolling Panda out in 2 phases, but this was the best approach for this project just due to the meaningful use requirements and the certification process. There's some information in your manual about attendance and quiz. It sounds like you guys have already taken care of the attendance component. You want to make sure you get with a super user to sign off on a Panda training roster. Once you do that, please, after this training, jump online. There is a link at the end of your training manual for a Panda quiz. Basically, there is a quiz for each training track within the Panda training system, so you guys will jump on it and participate in Medical 1 training. It's a really basic quiz. It's like 5 questions. If you pay attention at all, you'll get through it in less than 5 minutes, I promise. So really, how it's working is once we get the training roster and we get a completed and submitted quiz, that is when we're granting people access to the live system. So it's really important that you take responsibility to make sure you complete those 2 things so that you can access the live system to start entering patient data. Next section of your training manual is on HIPAA and EHR data security. Obviously, you guys are all in the medical department. You know how important HIPAA is. It's definitely a word that's thrown around quite frequently. With Panda, we've really been focused on the minimum necessary standard, which is a key protection component of HIPAA. Basically, it means that we should never access information in Panda unless we need to access it to do our job. I think it's really straightforward. If you're not assigned to client A, you shouldn't ever access client A's record. We do have a few safeguards in the system. The Panda audit log is probably the biggest safeguard. This was required by certification, and basically it tracks every move I make. If I log in, it tracks that. If I go to patient John Doe's medication list, it logs that. So using that audit log, we can see exactly what everybody does in the system and where they go. So it is really a helpful safeguard to keep our patients' information safe. The other item, there is a screenshot in your manual. The system will automatically log you off if you are inactive for 5 minutes. It does give you a pop-up warning, which I really appreciate because sometimes it's easy to get off track or working on something else. So you should never really get just kicked out of the system. It will warn you, it'll count you down, it'll let you know that you can either stay logged in or you can log out. There's some more information in there about HIPAA, possible penalties. The bottom line section in there basically is behavioral health info and psychiatric info is highly regulated and highly protected. And as professionals, we just need to make sure that we are being aware of our patients' data and doing everything that we can to make sure we're protecting it. Hopefully, you guys have received this training manual not only in paper, but also an electronic copy. I have asked the super users to send that out to everyone that attends training. Once you get an electronic copy, that table of contents in there, since it is a PDF, you can click on an item. Say you wanted to find out more information about non-medication allergies. You could click on that item in the table of contents and it will immediately take you to that page in the training manual. So I'm hoping that can be a good resource when people go live or even prior to go live as you guys are preparing. So some overall goals of Panda Medical Training. Definitely want to give some additional insight into some of the meaningful use objectives. Want to provide an overview on how to navigate Panda. Also definitely want everybody to gain some understanding of the Panda patient portal, how to portal users, because that is one of the meaningful use requirements. And also to learn how to complete basic medical documentation in the Panda system, including like nursing notes, vitals, etc. All right, let's get logged in. So you'll log in using your SQL email and password. Thankfully, you don't have to type out @sqluservices.com. I think that is like the longest possible email address ever. So please note you just need to do first name dot last name. When you first log in, the first time you log in, please click on your name in the upper right-hand corner and click on Profile Settings. When you go to Profile Settings, double check to make sure your time zone is accurate. I can tell you that the default currently is Eastern, so everybody at Bernalillo is definitely going to want to come in here and update this and make sure you change it to your correct time zone. This is important for timestamping documentation in the system, so you definitely want to do this the first time you log in. Another thing in here, if you're interested, there's different Panda themes. If you're interested in having a different color, I've kind of really love the black and white, so I haven't changed mine, but I have seen all the different colors that are out there. But if you're interested in having a different color for your theme, you can easily change that here too. All right, with regards to navigating Panda system, hopefully you guys are looking at the system and thinking this looks pretty straightforward. All your navigation items are going to appear here on the left-hand side. The items that appear and the submenus that appear are going to be specific to your security role. So as a medical professional, you will have access, obviously, to everything under the health menu that you would possibly need for any sort of documentation purposes. There are some pictures of some icons in your training manual. I'm not going to cover all of those. I put those in there kind of for reference, but I do want to talk about the first three because I feel they're the most important. The first one is that green plus sign. You're going to see that throughout the system to add new documentation. Also, the blue eye icon is used to view additional details of current documentation in the system. And then to edit documentation, you use the orange pen and paper icon that would be next to that item. Throughout this training, you may see the delete icon, which is a red garbage can. Currently, no one's going to have access to delete information except for system administrators. I think moving forward, they probably will identify one person at each SQL program that can manage the deleting of information from the system. So please just be aware of that. All right, selecting a client. So there's two ways to select a client. I can easily do it from anywhere in the system by clicking up here where it says no client selected. If I type in a few letters, it's going to search and it's going to give me a list of clients. The other way, let me see if I was in here just recently, so it may not do it. The other way, there's a screenshot in your manual. If you log into the system and you haven't been in the system for a while and you try to go, let's say you go to medical insurance. If I try to launch medical insurance, Panda's going to ask me to pick a client. So you'll get that little pop-up where it says set client. And again, you can just search by typing in a few letters of their name and that client can be selected. All right, let's talk about the client header. So the client header can be found throughout the system. I apologize, I clicked on the wrong one. You'll see this little down arrow, this little blue down arrow in the upper right-hand corner. This is the client header. With regards to the client header, this was specifically requested by one of the residential sites so that the photo of the client could be available from the majority of the screens where documentation takes place. I'm sure you guys use pictures also. It seems like a lot of the residential sites do. But this client header is going to allow you to see the photo of the patient, and you're going to be able to see some of the most critical information on the patient, the birth date, sex of the patient, non-medication allergies, any medication allergies they may have, medical insurance, and then any medical alerts that may have been added to the system for this patient. So again, this client header can be found throughout the system. If I click on that arrow, it will disappear again, just so you guys can have access, easy access to all the pertinent information. Required fields in the system are all marked with a red asterisk. If you try to save without completing a required field, the system will alert you, and then it will kind of highlight that field in red that needs to be completed that's missing. I just added this small section about Panda documentation. It is really critical to complete client documentation in a timely manner. I feel like some of this is a little bit common sense, but we've definitely had some issues with documentation not occurring in a timely manner, and we want to address this up front so everybody's really clear. You know, we get used to using paper documentation, and you can backdate or you can back time things because people get busy or they forget. That's something we can't do when we have an electronic medical record. There's no way to backdate documentation. There's no way to change the time of the entry. Everything we do is documented in the audit log. Even with like a medical encounter, if I set the date was last week, the audit log is going to know that it was set up for that day that I'm entering the documentation. So please just be aware of that. I know that is a big change for sites moving from paper to an electronic documentation. All right, I'm on page 12 of our manual, and I'm going to talk about the SQL MU objectives. So there are 10 MU objectives that we have to report on for 90 consecutive days in 2016. All the providers at Bernalillo are attesting to meaningful use using Panda. So this is definitely going to require a team effort. It definitely does not fall completely on the providers. I think it's really important for the nursing teams and even admissions to get involved where they can so that we can be successful with these reporting measures. So I want to run through these, make sure everybody's clear on how these work. and the details on them. So the first one, patient electronic access. We need to provide patient access to more than 50% of patients to allow them to view or download their health information. And during our 90-day reporting period, a minimum of one patient or patient authorized rep must log in to the patient portal to view their health information. So we are really recommending that the admissions team manage this piece of meaningful use. Basically, at the point of intake, they will set up a portal user for that patient. I understand with the residential sites, it's not really obvious that a patient would be able to get into the system and log in. So we're really encouraging the residential sites to set up proxy users, which could be the legal guardian or it could be the referring worker. Basically, anybody that has consent to see a patient's medical information can be set up as a proxy user. So we'll talk a little bit more about that coming up. Secure messaging. The capability for patients to send and receive secure messaging has to be enabled, which it already is. And for the 90-day reporting period, we need to send one secure message per eligible provider to a patient or a patient representative. So the good news about that is we can easily send the message through Panda. It's already set up. The person doesn't need to respond. They don't even need to read the secure message. We just have to show that we can send it. So I feel like that is going to be pretty easy to achieve. Public health reporting, we're currently already working with the state of New Mexico for the immunization reporting since you guys do administer the flu vaccine. We also are working for syndromic surveillance data. New Mexico is really the first state that we've run into that is ready to accept both forms of public health reporting data, which is pretty awesome. So you guys don't need to worry about anything with this in 2016. We just have to show them we're capable to submit this information to them. Protect patient health information. This is really our responsibility too. Willits will work with SQL to complete a security analysis to make sure we're protecting our patient health information. Clinical decision support. Implement 5 clinical decision support measures related to clinical quality measures. This one you guys don't need to worry about either. This is really our responsibility. We already have clinical decision support interventions currently active in Panda, so we will successfully meet that measure. Health information exchange. I'm going to talk about this in pretty great detail in Medical 2 training. Basically for a transition of care, so if a provider is referring a patient out to a specialist or if they're referring a patient's care to another provider, if they're transferring to a different program or maybe they're going to a hospital, we need to send a summary of care record 10% of the time electronically. So anybody that uses a certified health technology can send and receive the summary of care records, and the summary of care record is just basically a snapshot of the patient's health record. We will talk about that in greater detail coming up. Computerized physician order entry, I feel like this one's going to be really easy to achieve. 60% of med orders, 30% of lab orders, and 30% of radiology orders just need to be entered into Panda. We are really pushing for closer to 100%. I feel like if we're not entering all medication orders into Panda, we're not going to have an accurate and up-to-date medication list. And with regards to the MAR, if we want a medication to appear on the MAR, it has to be entered into Panda. So I do feel like we'll be able to get closer to 100% with all 3 of those items. The patient education resources provide patient education to 10% of patients. I feel like 10% is a pretty low number. We will talk about that in this training and how we can achieve that objective. E-prescribing, pretty straightforward. 50% of prescriptions need to be sent electronically to the pharmacy. Panda is fully enabled to send electronic prescriptions. We also just got certified for the electronic prescribing of controlled substances. So to be honest with you, I'm hoping that we can be close to 100% with e-prescribing. We can send a prescription to like 98% of pharmacies in the United States now. So hopefully that's going to alleviate a lot of paperwork and just processes through fax and things like that. And last but not least, medication reconciliation. Providers should perform MedRec for more than 50% of transition of care patients. So this one really does lie solely with the provider. We can support the provider in the MedRec by entering the medications into Panda so that they can reconcile them, and we are recommending that if we perform MedRec for every new admission, we'll meet this measure with no problems. All right. These first 3 Panda menus we'll run through fairly quickly. We're going to spend definitely the most majority of our time in the health menu. With regards to the admin menu, we're going to talk about the patient portal and a little bit about Panda secure messaging, and I'm going to show you guys how to set up portal users. But as I said, I'm really encouraging, especially at Bernalillo, the residential sites, to have admissions manage the portal user setup for the clients or their legal guardians. So when you go to admin, I know you guys are seeing a ton of different options, but you guys are going to see admin and you're going to see portal users. You won't see all that mumbo jumbo in between. So with regards to the patient portal, we are required to give patients, 50% of patients, access to the portal, and one patient has to log in. That could be the portal, or excuse me, that could be a proxy user, or it could be the patient themselves. So what is this patient portal that I keep talking about? It's basically a website it's kind of attached to Panda, where patients can view basic health information. It's going to contain their current medication list. It'll list out allergies that they have. It'll list diagnosis that they have. One thing to note, it does not contain detailed psychiatric or medical notes or nursing notes. That information is all still secure and completely locked into the Panda system and not available on the portal. I like to call it just a snapshot of the patient's health record is what it is. The portal also provides a platform for secure communication between clients and staff. So I think this is going to be super helpful over time. I'm sure you guys have a regular communication with a lot of the legal guardians and referring workers, but this may allow for communication through Panda where you can send messages to portal users without having to leave the Panda system. And these are secure. You can send PHI through the EMR system this way, which you obviously can't do through the email system. So how do people get access to the patient portal? A person has to be set up. With regards to this portal setup, it's really straightforward. All they need to have is an email address. And as I mentioned, it could be the patient, it could be their legal guardian, or it could be a referring worker. Basically, anyone who has consent to view the client's medical information can be a portal user for that patient. When do we need to give access to the patient portal? Our recommendation is that we're doing this at the point of admission. Point of intake. That way we're always guaranteed that it's going to link to the correct provider when the provider sees that patient the first time. For current clients, we need to make sure that we're setting up access prior to their first Panda encounter, which again is why we're trying to get people to set this up in advance prior to go live. For whatever reason, Meaningful Use decided to put a rule on this that if we don't have them set up prior to their first visit with the doc, we have to grant them access within 72 hours of their first encounter in Panda. So anything after 72 hours will not count and it will negatively impact our MU reporting numbers. So I'm definitely trying to encourage everybody to do this in advance. I will definitely be talking to the admissions team about this also so that they're on board. There is a section in your manual about proxy users. There's one caveat we need to make sure we're following through with, and I again think this is going to be an admissions role, but proxy users without exception, if a client has a portal proxy user set up during their treatment, the proxy user must be inactivated when the client discharges. It doesn't matter who the client is, how old they are, etc. We just have to protect their patient health information once they are discharged out of our care. All right, so let's talk about setting up a portal user. By coming to the portal users, again, you're going to find it under the admin menu. It'll probably be here on the top. It'll just be portal users. I'll click on the green plus sign. All I need is an email address. So let's say this is social worker at newmexico.org. Will be generic. You want to, this is active. When I just mentioned that we have to deactivate people when the client discharges, you would just come in here and click that button so that they're deactivated. That basically means they cannot any longer access the portal. So right now I want to make sure they are active though, so they can access the portal. Time zone, if they're in your time zone, if they're my time zone, I would make sure we're setting the correct time zone there. And then clients, this is actually the patient that we're giving access to. So let's say this social worker is, we'll say it's Panda Bear's social worker. So now this social worker can log in and she's going to be able to see Panda Bear's information. If you have a social worker that has multiple clients in your care, then you could add multiple clients here. Pretty straightforward. I am going to tell you that in the sandbox, this functionality, it does not work 100%. If I hit save right now, I'm going to get an error. Basically how this works is once I add the portal user and I hit save, it immediately sends an email to this portal user at the email address they provided, and it says, hey, welcome to the Sequel Youth and Family Services patient portal. Please follow this link to log into the portal and to set up your password. So they'll get that immediately when they're set up, and that's the reason why if I hit save now, I'm going to get that error because we are not connected to anything since this is a sandbox environment. All right, I'm on page 16 of your manual, Panda admissions menu. So basically this is going to be really brief. I just want to show you guys where you can access medical insurance. The admissions team will be entering medical insurance in here, so they'll be entering everybody's Medicaid information. If I need to come and see the Medicaid number, I need to see the group number, who's the person that's insured, I can easily see that. If I want additional details beyond what I can see here, I would click on that view icon, and it's going to give me all the details for every field that's available in there that's been completed. So pretty straightforward. I don't know how much you guys are going to need to access that. One thing to note too, if you use that client header, you will see the information for that medical insurance in the client header too, so you may not even need to access it through admissions, but I definitely want to make you guys aware of that. All right, client menu. Client demographics. Really straightforward. Again, you're going to see the basic client header at the top. Here's the demographic information for the patient. Anything that's entered in during intake or entered into this screen is going to appear in the demographics section. So you may have previous primary care information, previous psychiatrists, when they were admitted, date of birth, address, any of that information is going to be available in here. If you guys ever need to edit a field in here, you just click on the field. Let's say that we're going to make him have blue eyes. Select my item, and then I hit that checkbox to save. If I make a change and I don't want to save it, I would just X out, and that's basically the cancel button, so it won't save your information. So you can easily edit any field in here just by clicking on that field. Client contacts is the other thing I wanted to touch base on briefly in the client menu. So we are asking the admissions team to enter in the legal guardian and the emergency contact for the patient. If you feel in order for the medical team at your site to be successful, you need additional contacts in there, please communicate that with admissions. We definitely want to make sure we have all information in Panda that you guys will need to do your job. So with regards to the client contacts, when you come into this screen, we really want to do some updates to this prior to going live with Fat Panda. I really want to get the main phone number visible from this main screen so you don't actually have to open up the item to view it. But right now, if I wanted to see this caseworker's phone number, I'd click on that edit icon, and it's going to open up the contact information screen. So I can see the home phone number here. If we had an address, it would be listed here. Pretty straightforward. But you guys shouldn't need to add any contacts because we are really pushing the admissions team to do that. All right, last item I'm going to talk about under client is secure messaging. So I talked briefly about secure messaging. It basically allows us to communicate with a patient or a portal user without leaving the Panda system. You know, it's really important for us to be aware that patient health information really should never be sent through the SQL email system. This has a higher level of security. Panda is required to have one of the highest levels of security because it is patient health information. So please just be aware of that. One thing to note also, secure messaging is for external communication and should not be used for staff-to-staff internal communication. So you could come in here and set yourself up as a portal user and connect yourself to any client that you want, but that is A, going to impact our MU reporting numbers, which is going to skew some of our data, and B, the secure messaging is really made for communicating with portal users outside of our organization. So please be aware of that. So secure messaging could be used for appointment reminders, sharing test results, anything that you wanted to communicate through secure message, you can easily do that through this screen. It's very similar, it functions very similar to an email message type of system. So if I want to send a secure message, I'm going to hit that green plus sign. I'm going to choose my portal user. I'll send a message to Marianne. It's going to ask me to choose the client. So this list is only going to show the clients that are associated with that portal user. And then all I would need is the subject and the message. If you wanted to do a medication, you gotta be able to type first. medication update, and then you would just type in a message. And then when you hit send, again, they're going to receive an email to the email address that they set up as the portal user, and they will get a link basically that says, hey, come to the portal, you have a new secure message in the portal available and waiting for you. And you can respond back and forth. If you get a new secure message, it's going to appear here under this alerts. I have a lot of different alerts going on, but it would say new secure message, and you could just click on that and you'd be able to view the secure message that had come back from the portal. Again, this is not enabled 100% in the sandbox environment just because I'm not connected to anything. So if you try to do this or test this, you will get an error if you hit send. So I'm just going to cancel out of that. It is fully enabled in the live system, though, I can tell you that. All right, page 23, Panda Health menu. So based on the fact that we've already had 2 sites go live, Panda is bringing a lot of workflow changes. I think it's inevitable anytime you guys implement a new computer system or a new process. Panda is going to change the workflow for a lot of things, and not just the medical department, for other departments to come also. So as you guys are going through these trainings, please start thinking about your current workflow processes, how you can work Panda into your current processes, some things that may completely change because of Panda. I know one big one for Bernalillo is going to be your MAR. The pharmacy currently manages your MAR. That is going to completely change once you guys go live with Panda. The docs will e-prescribe, the medications will be available to be added to the MAR, and you guys will be able to manage the MAR and create individual MARs for each patient based on what you guys need. So I think that's one of the biggest workflow changes that I've heard about, but I'm sure there's going to be others. So please be aware of that moving forward. The health menu items that we're going to cover in Medical 1 are going to be the patient records and patient management. I'm also going to talk about a couple items under orders. The Medical 1 training is kind of more of an intro to the system. Medical 2 gets into some of the more advanced components like the e-prescribing and lab ordering and those items. So patient records is just that. You can find medical uploads, medical face sheet, smoking status, which I'm not really sure if that fits in here, but it ended up in here. Medical history for the family, health history, and lab results would be in here. So I'm just going to start at the top and work my way down. Medical uploads. Medical uploads could contain anything that needs to get into Panda that wasn't documented directly in Panda. So it could be past medical records, medication consents, immunization record, any sort of document that you would want to be in Panda that would be related to medical stuff for the patient. So in here, if I want to view one of these items that has been uploaded, I would just click on the download cloud. And the system is going to download that item. I use Google Chrome, when I use Google Chrome, you're going to see the download here at the bottom left-hand corner. In Internet Explorer, you're going to get a little pop-up that's right here in the middle, and it's outlined in yellow, and it'll say, hey, do you want to open this or save it, or so on. So you would just click on that item. It's going to open up a new website. I don't think there's anything exciting in this document. It says medication consent. So you can see the document that's been uploaded just by using that download cloud. If I need to add a new medical upload, I just hit that green plus sign. Let's say I wanted to add, I'm just going to do immunization record again. There's certain things that get stuck in my head and I can't think beyond them. Immunization record, I know that's not listed in our document tag, so I'm just going to choose other. The good thing about this information is both the name and the document tag are going to appear on the main screen. So if you wanted to say immunization record from Dr. Smith, and you could even put the date you received it from 6/1/2016. Be as detailed as you want with that documentation. The notes section, you can add any notes that you want about the medical upload. The notes section was just actually recently added, probably in the last 24 hours per request of Sequel Care of Arizona. And I'm sure this may apply to you guys also. But what was happening is they wanted to upload lab results to the system, and they needed the doc to be able to sign off on those lab results, and we didn't have any way for that to happen. So now the process that they're going to do is they're going to save their medical upload, and the doc will come in, he'll view the item, he'll edit it, and he'll put his initials here, or he'll put, sign his name. Oops. MD, to sign off on that upload, that he's viewed that upload. So that was just recently added. Not sure exactly how other sites are going to use that, but that was kind of a critical item for them to avoid having to print a lot of documentation. Let me just pick an item to get uploaded here. You'll notice when I actually upload, it doesn't say anything. You don't get any notification that it's uploaded. It just does it. I had a few calls on that when we first initially started saying, I don't see it getting uploaded, but it is there. Here it is, the item I just uploaded, and I can view it by clicking on that cloud. Pretty straightforward. Medical face sheet is next. If I click on the medical face sheet, this is really one of the only items, menu items, that we have in Panda that doesn't take you anywhere. It doesn't take you to the medical face sheet screen. It basically just downloads the medical face sheet, which is going to appear here in the bottom left-hand corner. This medical face sheet was created to support and supplement the face sheet that's available in Willett's database. And I'm not 100% sure if all the sites are going to be using this, but it definitely contains a lot of helpful information. It's going to contain the photo of the patient, their name, birth date, social security number, medical insurance, diagnosis, emergency contact information, current meds, really the most important information from the chart. The diagnosis, one thing to note, the item that's in bold is the primary diagnosis in the system. So I know that Woodward is using this, printing it out and sending it with patients when they go off campus to external medical appointments. So maybe that's something that Bernalillo may use it for also. But it is available there. All right, smoking status. I've gotten mixed reviews on this. It sounds like some sites really do document smoking status pretty regularly on patients. Some sites do not. So it is available here. This was required for certification. It used to be a meaningful use objective, but it's kind of aged out. So with the smoking status, I want to add a new one. Hit that green plus sign again. I'll select my smoking status from the drop-down. Let's say they're a former smoker. If you do give them cessation intervention, please document this here because there is a meaningful use clinical quality measure reporting item that we'll report on that looks for this. So if they are smoker, current smoker, then you would want to check that if you do provide that intervention. And then other thing you need is when it was documented in the Panda system. So really two fields if you need to add smoking status for a patient. Family medical history is next. This was also required for certification. The layout of this was monitored and set forth by certification. So just so everybody's clear on this main screen, this is our client, Ping Panda. Their father has been diagnosed with heart disease. All this coding needed to be in the system for certification, so obviously the most important item is the title. It'll tell you when it was created, and if it's been modified, it will document that also. If I want to add a new family medical history, I just hit that plus sign. I would search for the medical issue. Let me say depression. I'll select it from the list. Obviously, as you guys know, with ICD-10, now there's so many different options for these things, but this list should be complete. You can also search by the code if for some reason you know those. I'm sure there's people out there that do. So then I would select the family relationship of the patient. Let's say it was a paternal grandfather that's been diagnosed with depression in the past. If I want to document notes, I can, but it's not required. So I would just save that information. So it's really only two fields in there. You figure out, identify what the problem was, and you pick the client-family relationship. It's really up to each site to decide how they use some of these areas in the system. Since these are not mandated by meaningful use, there's no specific requirements for these items unless we were talking meaningful use. This was created as just a basic snapshot for patient health history. Some sites document this in the psychiatric eval, and they're not going to use this form. We have some other sites that really are going to use this form and requested to have specific items available in here. It's really straightforward. Just click in the box and you can add text in any area that's listed here. All right. I'm going to, just a heads up, I'm going to skip lab results. I really don't want anybody using lab results currently because it was created for certification and it is very complex and way more complex than would ever need to be. We have several tickets for development right now to get that area of the system cleaned up and just easier to use. Some of the certification stuff had so many different requirements that really honestly to me didn't make a whole lot of sense. So with lab results, if they're coming in, we're asking you guys to add them as medical uploads for now until we get something done with the lab results section. You can definitely look at it and go view it, decide if you want to use it or not, but there's literally like 25 fields in there that I really don't think are applicable. So please just use medical uploads for now and just know that that lab results section is a work in progress. All right, let's talk about patient management. I'm on page 30 of your manual. So really this is one of the main documentation areas in the system for just individual documentation of patient medical status. So non-medication allergies, any medical alerts, vital signs, medical notes of any kind can be entered in there, psychiatric notes, nursing notes, problem list and diagnosis, which are very, very similar, and we'll talk briefly about those, medical assessments, and the patient education resources that is required by meaningful use. So again, I'm going to start at the top, work my way down. So one thing to note in Panda is we had to put allergies in 2 locations. I definitely know this is not ideal, but because we are required to do drug interaction checks with allergies, all medication allergies have to be entered into the e-prescribing section of Panda. But we also needed a place for non-medication allergies. So this is the non-medication allergies section in Panda. If you come in here and your patient doesn't have any allergies, you can just easily click here and select no known allergies, and it will update that. I definitely recommend that you guys enter in patient allergies prior to go live. I think it's going to save time and it's going to make the providers happy. So with regards to allergies, if I need to add an allergy, I click on the green plus sign. I'm going to search for my allergy. We were required to have 6,000 different allergies available in Panda for certification because they had to link up to this UNI code. Let me tell you, if you search for an off allergy, I'm just going to type in Z as an example, these are some of the 6,000 allergies. And maybe some of you are thinking, I know exactly what some of those things are. Well, myself, I don't know what any of these things are. So what we did is we made a sub list of allergies for you guys to choose from that are in plain English. So I told the last group that I met with at Bernalillo that if you guys are running into allergies that are not on this short list or this sub list that we created, please email them to me and I will get them added to this list so that they're really easy to find and fast and you guys don't have any problems with that. I did get a report that you guys need cake frosting added as one of the allergies, which that was an interesting one to me. I haven't heard that one yet. So I do need to get that added still. So you'll just search for your allergy, select it. You do have to identify the allergy reaction. I think hives is probably one of the most common reactions, so I'm just going to select that. Date diagnosed, let's say this was from 2000. Oh wait, my patient's not even born by then. We'll say 2005. And then status will be active, that's the default. If you want, you can document the severity of the allergy, you can document the type of the allergy, or you can document any reaction notes that you may want to document. So it's really important that we do select the allergy and the allergy reaction from these lists because it is linked to that summary of care record that we're required to send for meaningful use. There'll be some areas in the system where you'll go in and you'll be like, oh my gosh, why is that field required? I can almost guarantee you that it is required because of something meaningful use needs. So please just be aware of that. We have had some requests to make some items not required, and then we just couldn't make those changes because of the certification requirements. So I'll just go ahead and save that information. And now I have Panda having an onion allergy. All right, Allergy Report. This was specifically requested by one of the residential sites. They post the allergy list on each dorm. I'm not sure if you guys do that at Bernalillo, but you're more than welcome to use this allergy report. It's really straightforward and basic. You're going to click on the little menu next to the green plus sign, and your only item there is that dorm allergies report. So I would select my location. I'm just going to select Woodward because I have a lot of patients there. I'm going to generate my report. Again, I'm going to get a download here in the bottom left-hand corner or in the center if I'm using good old Internet Explorer, and then this is the dorm allergy report. It's going to give you the name of the patient, their non-medication allergies, or any medication allergies that they may have. It's also going to give you the name of the dorm, and it's going to give you the date that it was printed. So totally up to you guys if you use that, but please just note that it is available if you guys need that. Medical alerts. I've added so many medical alerts that I'm running out of medical alert ideas. So with regards to medical alerts, these are going to appear on the medical face sheet. They are going to appear in the client header. You'll see them here. So anything that you feel is pertinent information that you would want somebody to know about this patient immediately when they go into their chart, you would add it as a medical alert. It could be seizure disorders. It could be any number of medical issues. It could also be non-medical issues. It could be behavioral issues. So with regards to medical alerts, I'm just going to hit that green plus sign to add it. Let's say violent outburst, violent behavior. Document when the start date of this issue was. If it ever expires, violent behavior may never expire. We hope that it does, but it may not. If you have like an AWOL risk or something like that and the alert has to be there for a week or 7 days, then when that expires, you just come in here and add the expiration date. Once you put an expiration date on a medical alert, it is going to remain on this main screen, but it is going to fall off of the header. So just please be aware of that. If you want something to stay on the medical alerts header and the medical face sheet alerts list indefinitely, make sure you don't put in an expiration date. If you do not want it to appear because it has expired, then you want to make sure you add that expiration date and it will remove it from this list. All right, let's talk vital signs. Vital signs, pretty basic and straightforward. It's going to show height, weight, systolic and diastolic, and the BMI. Panda automatically calculates the BMI for you, so I think that was one functionality that some of the people were kind of happy about, not having to calculate that for every patient. If I want to see additional information on a vital sign, I would just click on that view icon, see if there was any other additional information. Oh yeah, the pain scale is here, or any other details that were added. One thing to note while we're in here, Panda does have growth charts available. This was required for certification. So there's a growth chart for height, for weight, and for BMI. My poor patient is off the charts because he has had so many different vitals added in a very short period of time. So if you guys need those, they are available, not required by any means, but they are available if needed. If I want to add a new vital sign, I just hit that green plus sign, and I can enter in my vitals for my patient. If I want to add pulse, ooh, that's a high pulse. Temp, it will give you the temp source. Respirations, pain scale is here if you need to document any sort of pain for the patient. And any additional notes you may want to add about this vital sign, you can add those in that notes section. Once I add it, that is when the BMI is calculated and it will appear on this main screen here. All right, medical notes. I think this area of the system is probably going to be used the most frequently. So medical notes really could contain any sort of medical documentation. It could contain doctor's notes, nurse's notes. It could be documenting a conversation someone had, maybe you had with a parent. Anything could be entered into this medical notes section. I think there's some really great functionality available in this main screen. You can definitely sort the notes by date or by the title of the note. You can search based on who wrote the note. If you identify if it is a nursing note, physician note, or staff, so say I just wanted to see the nursing notes, I could select nurse and then select that little magnifying glass. It's going to give me just the nursing notes that were entered. You could sort by the date field. Say you wanted to look for all notes that have been entered in the past 30 days, if you wanted to view it that way. Or you can also search by keyword, which I think is kind of helpful. Let's say I wanted to search by ankle because I know that this patient had an ankle injury and I wanted to follow up on that. And it's going to identify that note. It's going to highlight the word that you have searched for. So all of those I hope are really helpful. Also, one thing to note, if you guys see this little files icon, this basically means that there is a file attached. So somebody has uploaded a document and attached it to the medical note. So if you want to view that, you would just click on that little files icon. So how do you add a medical note? Again, green plus sign. I'm sure you guys are getting tired of me saying that. We really try to be consistent throughout the system so it's easy to navigate. With the client medical note section, you can create your own templates. Based on the conversation I had with some of the other nursing staff at Bernalillo, they talked about maybe creating templates for a restraint order, or I'm trying to think of a couple other ones that they had brought up, but they thought you guys could definitely use this functionality to create some templates so you don't have to enter in documentation repeatedly. I have created just a couple really basic templates: nursing note for patient visit, a reason for visit, vitals taken, action, any follow-up needed. Really basic. If I want to add a new template, I just click here to manage my templates. Here's all the templates I've created so far. If I want to add a new one, I just hit that green plus sign and I can add a new template. You just have to have a name and then content of the template. You can copy and paste from other documents, like a Word document. Say you had something created and you wanted that to be in Panda. You can copy and paste into here if you want. So I think that's kind of helpful too. Let me get back to my medical notes. So with the medical note, all that's required is a title, nursing note, and you could put who documented it, Aaron Smith, RN. If you want, you could be as detailed as you want. This is visible from the main screen, so I think more detail is definitely better. Here's that note type. So if I know this is a nursing note, I would select nursing note. This is not a required field, but I think it's going to be helpful over time when you guys get lots and lots of nursing notes or lots of medical notes in the system to be able to sort by that note type. This date and time, if you click in here, it is going to immediately default to right here, right now. This was specifically created for Mingus Mountain. They had a good point that sometimes they want to document a nursing note and they saw that patient maybe an hour ago. They weren't able to document it right in that moment because they had 10 other things going on and they wanted to come back and they wanted to make sure that their documentation was accurate. So this was added for that. So if I saw this patient an hour ago, then I would just click on the little clock icon and I can change the time of that note when I actually saw that patient. This at the bottom has just recently been added. I didn't even know it had been added, so I haven't tested this functionality, but we are able to now lock notes. So basically what that means is a note can be locked down, then it cannot be edited by anyone. It can't even be edited by yourself if you lock the note. The only person that can unlock a note is a system administrator. So this functionality was really requested by some of the docs. They didn't want anybody getting in or tampering with any of their documentation. I can't really imagine that happening, but I'm sure there has been situations where that's occurred somewhere in the world. So we did add this functionality for them so they can lock that note down. I don't want to lock this note. I'm going to go ahead and save it. You also can upload a file here if you're interested in adding something to this medical note that's a paper document. All right, the problem list. The problem list and the diagnosis screens in Panda are almost identical. Both of them were required for certification. There's a lot of back and forth between, I think, medical professionals in general about what do we use a problem list for versus what do we use a diagnosis list for. Based on some research that I did, it basically sounds like the problem list should outline the most important health problems facing a patient. It should include active problems that a provider is working on with the patient. And one of the docs at Mingus had stated that they would likely use the problem list for more behavioral-based issues such as self-harm or isolation or cutting versus the diagnosis list, which they would have more medical diagnosis. That's just a personal opinion from one doctor. I have a feeling that different sites are going to use this differently. Some sites may not use the problem list at all. They may just choose to use the diagnosis list, which is fine. So with the problem list, if I want to add a new problem, I'm going to click on that green plus sign. I'm going to search for my problem, let's say anxiety. The more detail you put in this search, the smaller your list is going to be, so please be aware of that. So let's select anxiety disorder. It's going to show you the problem's been updated over here, and you're going to see it appearing here now. I can add notes if I want for this problem. If I want to make this problem also a diagnosis, I can do that here by selecting yes. Was this problem present prior to admission? I feel like a lot of the times it is yes, but we're not allowed to default that to yes. It has to be changed. So if that's something that's appropriate, then you want to make sure you are changing that. Status is always going to be active as the default, but can be changed to inactive or resolved. And then we need to document the date it was identified. All right, diagnosis, like I said, very, very similar to problems. You're gonna look at it and you're think, geez, it's exactly the same. There are a few minor differences when I go to add one. You do see the active diagnosis at the top, which I think is really helpful. This has recently been added. Primary diagnosis is really the only question that's different on the diagnosis screen versus the problem list screen. I think, when I think of diagnosis, I think the biggest difference is that diagnoses are usually used for billing services and problems usually are not. But again, I feel like they're so similar. So same process, I would just add, I feel like I've added the most common things that always come to mind for me. Let's do heart disease. You just search for your diagnosis, select the one that's most appropriate. Again, you'll get that same problem updated, and then I just need to add my date diagnosed. And again, if it was present prior to admission, I think it's good to document that always. All right, medical assessments. I promise we're getting close to being done. Medical assessments. So medical assessments has really become an area that has grown significantly since we started this project. There is a lot of medical assessments in the sandbox, but there is definitely more assessments in the live environment than there are in here. So please make sure if you're looking for something specific to check the live environment, if you're playing around the system prior to go live, because a lot of things have been added to that. We just didn't want to build it in both places. So this is the current list that's available. We're constantly adding additional ones. I know it was brought up that we do not have the AIMS assessment in here and that you guys may want to add your weekly assessment. So I do need copies of those if somebody is wanting those in the system, and we can easily create those with the assessment builder that's in Panda. I put some information in your manual on 3 different types of assessments. Let's do TB tests because I feel like that's a pretty common one. So I would select the assessment that I wanted to do. So you'll notice it says PPD skin test. This is the actual test information. So if you document the expiration date of the test, the administering nurse, the reason for test, that was required by one of the sites, but it's definitely not required. None of the fields in here are required, so you guys can really pick and choose what is most appropriate for your site. The site of injection, the date of the test. I'm going to backdate this because I'm going to update at the end and say it was given at 12 o'clock. You can document the manufacturer and the lot number if you like, if that's required for your site. And then I'm just going to go ahead and save that documentation. So as you all know, if you give TB tests, you have to come back in 2 days to have your TB test read. So if that was the case, if the patient came in to see me, I would find my TB test. I would click on that edit button. I would scroll down to the results section, and then I would document the results of the test. So if it was negative, let's say they read it at 1 p.m. and let's say it was Nurse Ann again. So you'll notice at the bottom that we have save and finish and we have save. If you want to lock your assessment because it's completed, it's done, there's no additional documentation that's required, you'll want to use the save and finish functionality. Like with this TB test, it's been administered and it's been read. There's really no reason for anybody to come in and make any changes to this, and we're just going to lock it and save it. It's not critical to lock those items. I think that there are some assessments that probably is really important to lock them so you don't have documentation changed by anybody accidentally, but I'm sure there's other assessments that it really is not that significant, and someone's not likely to go in and be making edits to somebody else's assessment anyways. So there is nursing assessments in there. Any assessment you guys really need, please just send it to me and we'll get it updated. and add in the system. I'll give you guys my email address and stuff at the end. All right, I'm in the last item of patient management, education resources. So I'm going to give this a minute to load. I apologize because I told myself I was going to switch my patient before doing this. Ping Panda, it's just going to run now. Ping Panda has about 100 lab results that have been loaded through some testing processes. And every time I click on this happened to me several times, it has to load all of these results from these labs into the patient education section. Okay, goodness, there it is. So patient education resources is a meaningful use objective. It's so important to make sure that we are meeting this. 10% of patient visits, the provider or the nurse has to provide patient education to that patient. So there's really two components to this. The provider needs to use education resources suggested by Panda, and they need to document that they provided patient education. And we'll talk about that towards the end of this. So there's two sections of patient education. This top section is general education resources. These are resources that have just been added by SQL or by myself just so that we had information in the system, but we can definitely add additional information. So we set this up so that it's filtered so you don't see everything when you first log in, because I anticipate this list is going to get mighty long. So if I want to see the general education resources, I just hit this little red box, exit out. And here are the education resources that have been currently logged and entered into the sandbox environment. Now, initially we talked about uploading all types of documents that sites use as patient education currently, but there is a requirement for certification that the education material has to have an internet URL, which I'm not even 100% sure why they make some of these rules, but they do what they do. So if you want to launch one of these items, you have to click on the URL, which is that little arrow. It's going to take you to that web page, and it's going to give you this documentation. You can easily print it. There's a little print icon here, or you could use Control-P to print the education resource for the patient. But it has to have a URL, so please just be aware of that. If there are specific education resources you guys want to add that you know have a URL, you can click on the green plus sign. You put in the title, you put in the URL, and the description is not required, but I think it's helpful, and then any keyword. So if this is something about, this is depression education, I would definitely put depression as the keyword. So if you search by that keyword, you're able to find that resource. I don't anticipate sites using this a whole lot to add additional resources, but that functionality is available if you guys are interested in it. This bottom section is really the most important part for meaningful use. Basically, each individual patient will have different education resources available based on the problem list, based on the medication list, and based on any lab results they have in their system. So with this patient, he has asthma, self-harm is on his problem list, anxiety. So we connected with this organization called Medline Plus Connect, and it's basically managed by the U.S. National Library of Medicine, and it provides a lot of different resources for medical teams. So here's my problem list ones. Here I'm getting down to my medications. Any medication that's on the patient's med list is going to appear, and it's going to give me some education options. And then at the bottom is the lab results section. If I want to view some more information on this, I just click on that more icon. And if I want to launch that page, I would just click on that link, and it's going to take me to that education resource on cholesterol. All right, let's talk about the most important part of this. So I'm going to get a little off track from your manual, but this is important. So the docs are going to document using the medical encounter, internal medical encounter, which this is a list of medical encounters listed here. I'm going to cover this in detail in medical training too, but I wanted to show you one thing. So when they go to load their encounter, this is where the doc is going to complete all documentation for a medical visit. And what we basically did is we pulled all of the really important documentation areas in the health menu into one screen. So you'll see vitals, you'll see med allergies, medications, non-med allergies, medical history. Everything that you would need would be in one location. I know it looks like a lot. We're not requiring the docs to document in all these sections. We just wanted to make them available to them so that it's easy for them to navigate from one place. This is the area I wanted to get to, this exam section. If they provide patient education, it has to be documented in this exam section. It's the only way to get credit for meaningful use. So this will default to no, but you would change it to yes. So when they're in here, they would change that to yes, and then they have to launch that education resources screen. That is really, and here I go again, I'm going to have my loading, oh here it goes. That is what triggers the meaningful use report. Changing it to yes and launching the education resources screen. You guys don't have to print resources from Panda. The measure basically says that Panda has to suggest education resources based on items in the patient's chart, and it does that through this bottom section. The doc is in complete control if they want to provide education on paper that they have in their office, if they want to provide verbal education, but they have to make sure, and I'm going to stress this to them too, I just want to make sure everybody's on the same page with this, because I know there may be situations where the nursing team's helping with documentation, or maybe they're providing education to a patient, that they're changing this to yes and then launching the education resources from this button. So please just be aware of that. We want to make sure we get credit for MU if we're doing all the things they ask us to do. All right, I only got a few more items to go. I'm back under the health menu, and I'm going to go to immunizations. So immunizations is an MU objective, but you guys don't have to worry about this in 2016. Basically, the requirement is that we have to work with the state of New Mexico and show them that we can send them the healthcare coded documentation that they require. So we are in communication with them already, and we will send that test information during your guys' 90-day reporting period so that we can be successful with this measure in 2016. In 2017, we will have to submit our immunization data to the state of New Mexico through Panda. It is part of the meaningful use requirement. So with immunizations, I know you guys only do the flu. You would come in here, you'd hit the plus sign. I'm going to select my vaccine, search by flu. I was definitely blown away by how many flu vaccines are in this list. If there's something you guys use that's not in this list, please let me know, because I'm sure we can get it added. We did pull this from the CDC website though, so I'm hoping it's really accurate. The administered, if I click in here, again, it's going to default to today's date and time. You can change that by using the calendar or the clock. Administered amount, we'll select from the drop down. Manufacturer, all drug manufacturers should be appearing there. The lot number, I always feel like there's so much required documentation for immunizations, but I do understand that there is a reason for all that. You'll notice here that if you don't know, you can always enter unknown. I feel very strongly that the state of New Mexico is going to require all this information, so we might as well get in the habit of doing it now. So you'll just go through, select the items that are appropriate. This is always going to default to new immunization record. There are options in here for historical documentation. I don't anticipate any of our sites using historical documentation through the immunization section. I feel like the best approach is just to upload the current immunization record for the patient, since we really, and I mean, you guys definitely can use this for that, but it is not required, but we had to have it for certification purposes. Who ordered it? This will be a list of your docs at your site. The administered by will be a list of your docs and your nurses at your site. VFC eligible, I anticipate that all of your patients are going to be VFC eligible, since it sounds like they're all Medicaid patients. Refusal code could be documented here. Evidence of immunity, if the patient refuses and it's because they've already received the flu vaccine, that could be documented here. Notes, and then is this client immunization an error? If you go back in and it was an error, you can change that to yes. I don't anticipate sites using this either. There are also some additional fields here, show optional data, and there's some state immunization registry fields there, but right now, no need to worry about that. So I do plan on probably having a training in late 2016 on the immunization documentation specifically for the state of New Mexico. Every single state has different requirements, which makes it quite challenging as the EMR vendor, but we will be testing with all the states that have residential sites and administer immunizations, and I know that I want to make sure that you guys have all the information you need so we can be successful with New Mexico. So do your best at this time. I think it's just important to cover the required fields, and then once we get closer to communicating with New Mexico, there may be some additional fields we have to add or some additional requirements that we will talk about at that time. All right, scroll down through my manual here. I got 2 more things to cover. Procedures. There has been a little bit of talk about this. Some sites do a lot of procedure orders. Some sites don't do a lot of procedure orders. Sometimes they're sent off-site for procedures. Sometimes they're done in-house. You guys can really use this area of the system as you see fit. So with procedures, if I want to add a new one, I would just hit the green plus sign. I would search for that procedure. I'm just going to choose EKG again just because it's right on the tip of my tongue and I don't want to spend time finding something else. So I would select my procedure. You can document the diagnosis associated with the procedure if you need to. The date it was performed, that's going to be the date the procedure is ordered or the procedure takes place, what date the appointment is for. So let me say that this is going to be for tomorrow. The administered by field. So if it's somebody from within SQL, you're always going to choose existing provider, internal, and then you're going to have a list of your docs and nurses at your site. If for some reason it's a new provider, it's going to require us to document these fields. Now I know you're thinking, oh my gosh, that's a lot of fields, that's a lot of information. I wish I could tell you that we could change this, but we can't. This is required for that summary of care record. So my recommendation is that if you guys have people that you consistently send clients to for procedures or specific types of tests or anything, I would add them in here, and as you go, you'll just get a good long list so you're not having to constantly add it. If I add a new provider here, it gives me the option here to say save external provider for later use. So then when I come back, that provider is going to be in here. So you really should only have to enter this one time for providers we refer out to or we send procedure orders to. So please just be aware of that. I know there's a lot of fields there. I've gone back and forth with the developers about this, and it's just out of our control with regards to those fields. So please be aware of that. We're not trying to make it painful, I promise. And same with the authorizing provider type. It's almost the exact same functionality. I'm going to go ahead and just select internal to keep it simple. All right, I'm in the last section. I know you guys are thinking, thank goodness. Referral orders. So referral orders is definitely really important that we're entering all referrals into Panda. The main reason for this is because of that health information exchange meaningful use requirement. We are required, to refresh your memory, 10% of referrals or transition of cares, we are required to send the summary of care record electronically to that receiving provider or that referred provider. So I am recommending that if you guys have people that you refer to frequently, say you guys work with a neurologist on a regular basis, I would call that neurologist before go live and I would say, are you using a certified health record right now? Are you guys using a certified EMR? And if they say yes, you're going to ask them, can we please get your direct messaging address? Because the direct messaging address is basically like an email address, and I'm going to talk about this more in medical too, but it's basically like an email address where we can send them the summary of care record from Panda to their EMR, and they'll receive it in their EMR. I do feel like a lot of providers are using certified health technology right now just because of the incentive money from meaningful use. So I'm hoping that you're going to run into a lot of situations where your docs are going to say, yeah, we have that functionality and here's our direct messaging address. So 10% of the time we just need to be aware of that. So with regard to entering client referral orders, I'm just going to hit this green plus sign. I'm going to enter in the reason for the referral. Diagnosis can be added. The referring provider. This will be a list of the docs at your site. You can document the urgency of it. The type, this was required for certification, so just do your best to figure out what is most appropriate for your referral service type. Date of the referral order is going to default to today's date. Date of the referral appointment, this is going to be not required soon. We talked actually to the other Bernalillo team, or the nursing folks that were on the call earlier this week, and they made a really good point, and we've been talking about this on and off for a couple months now, but when you guys go to set up an appointment, they want the referral order in hand. They already want to have it. So we are going to make this so it's not required, because I know this is going to cause some issues. I'm hoping that we can actually get that done maybe even today. So I'm going to follow up with the developers about that. So the date of the referral appointment would be the date they actually go for that appointment, and it just sounds like that is just not an appropriate thing to have required. We'll probably still leave it there. We'll just change that as a required field. We'll say they're going to be to refer to Dr. Smith, and they do require that we have provider's phone number. Address information is not required. I'm going to save this. It's going to take me to the transition of care screen, but I'm going to go back because we are going to talk about that in medical too in detail. So if you guys need to print that referral order that we just created, you would just hit this print icon. It's going to download that document, and any details you put in are going to appear on this printed order. So as many details as you want, you're going to, I think even with the comment section or the note section, if there's specific information you want that provider to have that you're referring to, I think you should document it in this area so that it can be actually attached to that order. All right, a couple little things at the end here. Panda Go Live support. What do you do if you have a question about Panda? Definitely want to reach out to the super users in your department. There has been identified at least a minimum of 1 super user per department. We're really hoping for 2, so if anybody else wants to volunteer to be super users, let me know. Basically, they are just attending all the trainings and having some additional training so that they are more educated on Panda and feel comfortable in that role of trying to help people when they're going through issues or questions with the system. So please reach out to your super users first. If the super user or your other teammates can't answer your question, please send an email to it's panda@teamwillets.com, and there is a link to that in your training manual. This basically creates a support ticket, and someone from SQL or Willets will follow up with you either by email or phone. So if it's a training question, it'll probably be myself or Amber Taranis that follows up with you. If it is a more technical based question, like say maybe you ran into an error or you can't log into the system or something along those lines, someone from the Willets IT team will be following up with you. Please make sure your contact information is included, which I think is pretty straightforward since most people have a signature on their email these days. And then if you have a high priority issue, which I think really are issues related to patient safety, medications comes to mind first, please make sure you're saying high priority in the title of your email. We've also created a Panda suggestion box, and that is available on the SQL staff portal. So if you're going in the system and you're thinking, man, I wish it did this, or it would really save me a lot of time if the system did that, please go to that suggestion box and add your suggestions. The SQL team is reviewing each of those suggestions as they come in, and I think we can really improve the system over time using the suggestions you guys provide. So please also note, if you guys have suggestions, use that suggestion box and don't use that panda@teamwillets.com email, just because that is really a support ticket system, and we definitely don't want those suggestions either getting lost or adding more support tickets to the team. The sandbox, I know you guys have seen, I've been in the sandbox all day. You will notice with the sandbox you're going to see a pile of sand and a shovel. It's really important when you first log in to note which environment you're in. In the live environment, it just says Panda. There's no graphics associated with it in any way, but you always want to make sure you're double checking that. I go back and forth a lot, so I'm always checking. I don't want to add test documentation or be testing anything in the live environment. I definitely don't want to do either the opposite of that, where I'm entering live information into the sandbox. So please be aware of that. There is a link in your training manual to the sandbox. You guys all currently have access to the sandbox, so feel free to get in the system, play around, maybe start getting comfortable with how it works. Hopefully that'll be helpful. One reminder, the attendance and quiz, make sure you're signing that training roster, and also make sure you are completing your quiz. With regards to that quiz, there is a link. It's certified.sqlpanda.com. You'll log in, there's a big Panda, I can't think of the word, Panda icon available right when you first log in. I'll say become a certified Panda user, and you just need to complete one of the quizzes below. So this is Medical 1, so just select Quiz 3, Medical 1. You'll enter in your name and you'll select your location. And then there is 6 questions, multiple choice, and I honestly feel like you guys can do this in probably less than 5 minutes. So please make sure you're getting in and doing the quiz so that you can get access to the live environment.